Good evening, everyone. We'll be getting started shortly. We're just allowing a few more people to join us, and we will get started in just a few moments. We thank you all for joining us tonight. Again, we're just waiting for a few more folks to join us. Hi there. Welcome to Emsculpt Happy Hour. We would like to thank you all for joining us today as we learn how to burn, build, and bloom into your best self with the newest services offered by SusanMurrman Center for Body Contouring 360, Emsculpt, Emsella, and Emtone. SusanMurrman Center for Wellness and Health and the Center for LASIK and Aesthetics embraces a whole person, 360-degree approach for each individual that includes total body wellness with a personal experience to make a positive difference in the patient's lives. Tonight's presenter is Dr. SusanMurrman. We're excited to have her with us, and she is an expert in so many different areas, and we're really proud of her and the clinic and everything that they continue to do to advance wellness. Dr. Murrman is the co-founder of SusanMurrman Center for Wellness and Health and SusanMurrman Center for Laser and Aesthetics. Dr. Murrman is continually learning and working to stay abreast of medical advancements. Dr. Murrman encourages women to greatly care for themselves inside and out and believes medicine should be about practicing prevention instead of intervention. She's a big proponent of making sure patients are inquisitive and informed as much as possible and really learning about their own health. She specializes in bioidentical hormone and pellet therapy, anti-aging, functional, and peptide medicine specialist, expert in minimally invasive surgical procedures and gel point single-site surgery for fibroids, pelvic pain, and abnormal bleeding. She's also an expert in vaginal rejuvenation, ThermaV, CO2 Lift V, VFit, O-Shot, and PRP rejuvenation. Aesthetics gynecology, including labiaplasty. She also offers in-office liposuction, fat transfer, and minimally invasive abdominoplasty. Certified in fasting, nutrition, and longevity medicine. Hormonal imbalances also in young women she's an expert in. So now I'd like to introduce you to our host and our expert who's going to share with you all about how to burn, build, and bloom. Dr. SusanMurrman.
Thank you, Valerie, and welcome everybody, and cheers to another happy hour session that we've created this series, and hopefully there'll be a lot more. But this one is a very timely one because we are so into technology here and into making women feel better and look better so they can live healthier lives because it's all kind of a trickle-down effect, that I was so excited to be a part of this and introduce our new technology. For those of you who know, we do have SusanMurrman Center for Wellness and Health and Center for Laser and Aesthetics. We promote individualized health experience 360. We have Dr. McDonald and Dr. Donato, who are two of my partners I can't say enough about, who bought into this whole wellness approach to women's health. It's not just about pap smears, it's just not about gynecology, but it's about taking care of the whole patient. So I really appreciate them being on board with this thought process, and we've all done the homework, we've all done the studies. We've really transformed our whole office into having a total experience, including on-site mammography. We call it Beautiful Medicine 360. And so we've sort of wrapped our arms around both clinics, which we have the aesthetic clinic and the wellness clinic, because we all believe that these two clinics go hand in hand when it comes to women's health. And we have been developing this. Well, I've been developing it in the last several years, but in the last 2 years, 2.5 years, we've really made progress on almost getting everything that we want under one roof. So let me tell you, we've always had the Center for Body Contouring 360, but I want to tell you the history of what we've done with that. We started out over 15 years ago with liposuction. And liposuction, we did not want it to be a one-time deal where you got some fat sucked out and you went on, lived the rest of your life. We wanted it to jumpstart your health, which we really want women to eat better, exercise, because nothing lasts forever. And I don't care how much, fat that we take out of you, what's going to happen is it's all going to come back someplace else. So we really wanted that to be a jumpstart for women's health. We've added fat transfer in the last 10 years, and that, why waste good fat? That's kind of what I say. So we use fat transfer. We can use it in all parts of the body. We've done it in the face. But then we started embracing some other energy devices, which I'm all about energy devices. I have been in surgery. In my minimally invasive surgery career, I've done several studies, and I use different types of energy devices in surgery. So I'm very familiar with that in surgery, but the applications that come when it comes to your face, comes to the rest of your body, are just fascinating. So we bought ThermiSmooth probably 8 years ago. And ThermiSmooth is a radio frequency device that was FDA approved for cellulite. It's skin tightening. It has great effects on the skin. And after that, when they started branching off into other areas, we got Thermiva. And Thermiva, our clinic was part of the original studies when it came to vaginal tightening, treating incontinence, and treating atrophic symptoms of menopause in the vaginal area. And it was a radiofrequency treatment, and it worked great. We had great results when it came to studies. So me just loving energy and energy devices like I do, really, really looked at what else was out there in the market. And I've been exposed to electromagnetic energy and knew the company that was doing it, and kind of danced around with it a while until I saw some good studies and saw what was going on. I was so impressed that I brought Emsculpt and Emtone and Emsella in for a demo in the office, and it blew the whole office away and the other physicians. So that's what we're going to talk about tonight. So let's begin. Do you have your glass ready? Here's our happy hour, and here's to energy and how energy can improve your life. So let's talk a little bit about Emsculpt. Emsculpt is a novel device. We've looked at other body sculpting devices before. We've had tons of people come and talk to us about cool sculpting, which they didn't have enough studies. I wasn't quite sure that mode of energy was great when it came to fat loss or even body sculpting. I don't think there's any sculpting in cool sculpting. And I've seen some people with some irregular results. So when Emsculpt came around, I was totally impressed with it because it not only helps with fat loss. I mean, you're not going to get, the liposuction effect, but it also built your muscles up, because a lot of patients that I do liposuction on, I saw that they had muscle tone problems. They have visceral fat, or they have muscle tone. So I could take off all the fat, but they still sort of had a belly that pooched out because they weren't working out, or they weren't doing the right diet because they have the visceral fat, which the visceral fat is the fat underneath the muscle inside the belly. And that's toxic fat. That's toxic fat to your body. It produces all sorts of inflammatory effects. So reducing that is part of an ongoing problem. So Emsculpt was based on high-intensity focused electromagnetic energy. One session that lasts 30 minutes causes thousands, up to 20,000 contractions in your muscle, which is important for improving tone, strength of your muscles. So these powerful muscle contractions can't do it on your own. If you try to do 20,000 sit-ups in 30 minutes, you would get muscle necrosis. You would have all sorts of problems. It would be not beneficial. But the electromagnetic energy and the way it's induced in your body does not allow that to happen. So you're getting the benefit of the contractions. You're getting the benefit of weight loss, not total weight loss, but about 23% weight loss in 6 sessions. So the muscle tissue actually needs energy. So when the muscle needs energy because it's contracting, it's going to go to the fat cells in your body and pull that energy to get the glucose to contract. So it's kind of working your body out by using the fat that's in your body. It's the first device to build muscle and sculpt your body. There's nothing else like that on the market. There's other lookalikes. I swear to God, I got a Sharper Image catalog the other day in the mail, and I actually sold a device you can stick on your belly and put a battery in it, and it will do the same thing. Not quite. So Emsculpt procedure is FDA cleared. It has over 35 studies, including those with MRIs, to look at the muscle that you're building, including what I like to see is a lot of women that have had babies when they have diastasis of the rectus muscles, and that means their center line has been expanded, their muscles have been expanded, so you just have fascia. So they tend to look like they've got a hernia. It actually closes that gap. So it's the perfect thing if you're going to have a baby and then after you've had a baby to actually help with the diastasis so you can be stronger and fitter after your pregnancies and for the next one. So it works on your abdominals, it works on your buttocks, it works on your arms, your calves, and your thighs. I think it's great. I've used it a lot with my patients that I've done liposuction on because I think that in combination with Emtone can give you more of a textured look with the skin and with getting those muscles to contract and reducing belly fat. It's a workout. Yes, it is. It's non-radiating. It's non-thermal. It's not ionizing. It is totally non-invasive. So the treatment lasts about 30 minutes with a maximum or minimum of 4 sessions, but I recommend 6 sessions, done 1 to 2 times a week. What's it feel like? I've done it, 6 treatments already, and maybe more considering demos, but it's a contraction. You can feel your muscles contract. It feels a little strange, but it's working. And it also has a feature on it that sounds like it's an MRI machine where it's pounding, but what it's doing, it's increasing circulation to your muscles. So it's clearing out all that lactic acid that builds up in your muscles and causes the pain. So you may feel a little sore the next day, but you're not going to feel the pain if you've done 20,000 contractions. You can lay down, watch TV, relax during the treatment. We like to combine it with other treatments. We combine it with IV therapy. We have IV therapy here at the office, and a lot of patients will get IV therapy while the Emsculpt is going on. Or if you're in the skin and laser and you're getting numbed for a procedure, you've got 40 to 45 minutes of downtime. You might as well exercise and burn some fat while you're laying there. It's non-invasive and there's no contact. So I've got to figure out how to do this. Where do I go? Am I going here? Yeah. All right, here we go. This is an actual video of an Emsculpt procedure. You can see right there how it's contracting the muscles. That's the machine right there. We have varying degrees of it to actually increase. So we increase it to your own personal comfort. And then right when this, you can see the muscles contracting right now. And then in a second, you're going to see it looped back around. That's the pulsing that's actually increasing your blood flow to your belly and getting that lactic acid out. Okay, I need help again. Sorry about this. This is a new system. Okay, good. So next time I won't have to do that. So here, what is neo about Emsculpt? Well, this is a brainchild. I can't even tell you how much of a brainchild it is. But what about combining Emsculpt, which is muscle contractions, electromagnetic energy, with radio frequency, which we've been doing in our clinic for a long time. And I'm a total believer in radio frequency energy for all sorts of purposes, even when I use it in surgery. Radio frequency energy contracts tissue. It helps with fine lines and wrinkles. It helps tighten tissue. It increases collagen and elastin. But what if we put it with electromagnetic energy, which is actually contracting your muscles? I mean, that actually, to me, is incredible. And they just came out with it. So how lucky can we be? So this is in Bizarre Magazine talking about it. You're going to hear a lot more about this in the months to come, but it's the latest device. It combines 2 sculpting treatments in one, which is totally exciting. Like I said, it's my 2 favorite energy devices rolled into one device. Nobody's done this before because virtually, I mean, they have the company that has put out Emsculpt has the researchers that were able to do this, because with radio frequency energy, it's hard to combine with electromagnetic energy because of the 2 competing energy devices. So let's look at the difference. When it comes to cool sculpting, there's only 5 or 6 studies out in cool sculpting. And if you look at the average fat loss with cool sculpting, and that's probably, you're picking and choosing what area to do for cool sculpting. So you're going to get 22% fat loss, and it's going to be irregular because you can't put that device over your entire abdomen. You've got to do it in sections. Emsculpt has 23% fat loss plus muscle mass gain, and it actually is, it's actually taking the fat from everywhere else, not just in that particular area. Now, Emsculpt on steroids, Emsculpt Neo, 30% fat loss plus more muscle mass gain, which I think is pretty incredible. I had a chance to demo this, and the contractions, I can tell you, are actually more intense than you would get with the Emsculpt by itself. So Emtone, what is Emtone? Emtone is another FDA device that is approved for cellulite. We all know what cellulite is. I really don't have to explain it to you. Everybody has it. It gets worse as you get older. It's sun damage, it's age, it's accumulation of fat, it's bands of fibrous tissue that contract, then skin laxity, and then you gain weight, and the little fat pockets just pop out in between that. It's hard to avoid. I think it's hormonally based as well. But this is the only device that stimulates, simultaneously delivers radio frequency energy, which again, I can't say enough about. Is my favorite energy in the entire world. And mechanical energy, because it has a targeted pressure. So you kind of hear it hitting, it's giving your tissue like a massage. It's breaking up that fat and delivering the heat to that area. So it's not about tone, it's about tone, it's not about texture. It's the first non-invasive device to provide effective cellulite treatment with no downtime. There is no downtime. I'm telling you, of course, I've had this too, but it is like having a very vibrant hot stone massage, and you can just feel almost like your lymphatics are clearing out. So how do you get rid of cellulite? Emtone is ideal for it. It helps with skin appearance because it's radio frequency energy as well. The treatments, depends on how old you are, is how long they last. It's an individual treatment plan. The older you get, probably the shorter amount of time it's going to last, but getting a touch-up is always a great plan. 4 treatments are recommended, but we go up to 6. Each treatment is about 20 minutes, depending on that area. Patients can see improvement like within the first treatment, but best time to look at it is 2 months afterwards, after you've finished 6 treatments. So these are some before and after photos of Emtone. Okay, and I'm going to show you a video. This is the Emtone machine, and this is the Emtone right here, where there's a lot of work going on between the person that's applying it, and also you're going to feel a massage, and all the movements are actually directed towards your lymphatic drainage. So while you're causing fat apoptosis or lipolysis, which means your fat cells are just dying off, all the triglycerides that are inside your fat cells are actually being pushed towards the lymphatics. It's a very comfortable procedure. You're not feeling too hot at all. And you can see the circular movements all going towards lymphatic drainage. Okay, see, I got this time. So what do I recommend? Because knowing the technology, what I do about radio frequency energy and about wanting to get best results, best thing you can do before your procedure is hydrate, hydrate, hydrate. I mean, drink lots of water, because all these energy devices are attracted to water. So you want that to be hydrated, plump up your cells so you can actually get a better result. And because Emsculpt especially is pulling from your fat cells to get energy to build your muscle, if you're not eating prior to your procedure, it's going to go to your fat. I don't want it to go to the hamburger or the Chick-fil-A that you ate at lunchtime and pull from there. I want it to go to your fat cells, get that glucose for energy to build muscle. So all treatments, like, liposuction I told you about earlier, you're only as good as your diet and your exercise. So changing your diet, getting your diet right for the best part is what you can do. And all treatments are better when you make those diet changes and you make the right choices. So let's talk about Emsella, which is another electromagnetic energy device, which is what came out first when it came to all these other procedures. And it looks silly. I saw it when I was at all these meetings. I wasn't quite sure I believed in it. I sat in the chair. I wasn't sure if, what was going to work. But then when I started doing the research behind Emsella and about what it does and all the studies that it has, I was just blown away. So we brought that into the office for a demo. So it's another breakthrough treatment for incontinence. It's unique. There's nothing else like it on the market. Strictly for incontinence, although it has other benefits, and it's completely non-invasive, and it's no contact. Nobody touches you. You sit there in this chair, and for 28 minutes, it delivers electromagnetic energy. So incontinence, we all know, is caused by weak pelvic floor muscles, and your muscles get weaker as you get older, your anatomy changes, and childbirth also alters your pelvic floor muscles. They're not as strong. So these changes, you want to rebuild your pelvic floor musculature. You can't sit there and do Kegels for the rest of your life. They're hard. I don't know how you're going to do them, but you need some sort of strength. So it works, showing like the first picture, your pelvic floor muscles, or they're not supporting your pelvic floor, which is the area, that's your perineum, and deeper to that is your pelvic floor area. Has all sorts of different muscles that relax or tear, especially with childbirth, or get more lax with lack of hormones. The treatment is thousands of contractions. Now, it's not like Emsculpt where you can see that your abdomen is contracting, but it's giving your little muscle stimulations to that pelvic floor musculature. And the stimulation leads to regained control over your pelvic floor muscles and your bladder. So the treatment, like I said, is it's really 28 minutes. You need like 6 sessions, although when we first brought it in for a demo, we brought a patient in, 85 years old, vibrant lady, still driving, loved life, living at home. And she was going to the bathroom every 15 minutes because she had overactive bladder. Keeping her up, she couldn't go to sleep. It was traumatizing to her. So I brought her in just for one treatment. She called back the next day and said that her bladder was amazing. She was going to the bathroom maybe now every 4 to 5 times an hour, or maybe 6 times an hour. So it changed her life just in one treatment. So I was sold on it when we did that. The treatment, it feels like you're getting little energy pulses up through your pelvic floor. It's not like the Emsella where it's big contractions, you're going to feel it. It's like little, you can feel the pulses. Again, a single session, you may see one area of improvement, but to get the full benefit, you really need 6 things, and 6 treatments, and they last all the way up to 8 months a year. It's easier and more effective than me sending you to pelvic floor therapy, which can last months and may have some good results and may not. It's a quicker way to get to your results that you want. Okay, here's a video. I hope it works.
It does. So I'm trying to.
It's not working?
No, but we may have a.
It's not going to work. Well, I'm sorry, it's not going to work, but it was going to show you exactly an animated video of what happens when you sit on that chair. So people are asking me, what's the difference between Emsella versus Thermiva? And we know we've had Thermiva, which is a radio frequency device, in our office, for 8 years now. We did the studies on it. We saw the benefits with sexual function, atrophic vaginitis, vaginal laxity, incontinence. So Emsella and Thermiva are 2 different things. One, Emsella is non-invasive, just like Thermiva is, but it works mainly on incontinence and increasing pelvic floor musculature, and can also have some effect on sexual function. I think it's perfect for postpartum and prepartum pelvic strengthening, because we know that's a problem right after you give birth. Why not get stronger and build your muscles back so when you have your next child, you're in perfect shape for it. Thermiva is more of a combination device for aesthetics. It does have an external application where the radio frequency energy is delivered. It does plump your external vaginal area. It does help moisture on that area. It does give you some vaginal tightening and for pelvic relaxation, because there's direct application of that radio frequency energy. We've seen great progress with overactive bladder, stress urinary incontinence, painful intercourse due to lack of hormones has been amazing, and a lot of menopausal vaginal symptoms. They're both, fabulous treatments, and but just like as you age, whatever your results are not going to be permanent. Just like if you had a facelift, 5-10 years from now, you're going to have another facelift. So these are the same way. You're going to maintain it probably once a year. We have a new member to our team here, and her name is Ginger Morgan, and she's been amazing. She's a certified medical esthetician. She is now head of our Center for Body Contouring 360. She has her own number, and it's a direct number. And so if you're interested in any of these procedures, please call her. You can visit our website to learn a lot more. It's mmcwh360.com. You can follow us on social media, but she's great. She'll take your phone calls. She'll walk you through the process. We'll figure out if you're a good candidate for any of these procedures. So give Ginger a call. She's great. And we appreciate you guys being here with us tonight. It's been a lot of fun, and we're going to do this again sometime, because we like our wine and we like a happy hour. But we also like to look good and feel our best and take care of ourselves. So you guys take care of yourselves, stay safe, and I hope to see you soon. Good night.